Whoa.
That's Blockade. Jeez, I'm trying to stay on the thing. Yep. That's tough. That's tough. We gotta start somewhere.
Another one.
I got the pinky on that one. Can't get. I'll take your toe off. No, that's it. I'm going in there. All right, fair enough. Oh yeah. So we call this anterolisthesis of 6 on 5. So the C6 vertebrae is forward, and that's what's actually causing a shearing force that's grinding that disc. Do you understand?
Mm-hmm.
The discs can handle compressive forces very well, but they can't handle
Yes.
shearing forces. So a big accident in '08, and then you're saying about 6 years later you had a really bad headache, and then at that point you said tell me what happened when you got home.
So yeah, I got home and told my wife I had a really, really bad headache. She told me, maybe I should lay down, and she said when I went to go lay down, I just laid like, she thought I was playing around like, ugh, but she saw that I started shaking, so she noticed I was having a seizure.
Okay.
Go to the hospital, kidneys were failing. They wanted me to be on dialysis and whatnot, so stay there for a little bit. They do their little 3 nights treatment and whatnot, and they let me know that I had a seizure and gonna do some head scans and stuff like that. But during that time of them trying to find out what was going on and the medication, I was probably having seizures twice a week. Wow. And I had one where fell, so I got a crack. I go to the hospital again. Again, kidneys are failing. Then I had another. I was driving a little side-by-side vehicle,
Yep.
and I had a seizure on that, and I ended up hitting a pole. Hospital again. So I know it's been horrible. And then just recently in 2021, I was assaulted with my cousin. I was assaulted and got 2 bones in my jaw fractured.
Okay.
And then went to the hospital for there, and then all the head scans. But from there is when it took off. Everything started really speeding up.
That's 2 years ago?
Yes.
Okay.
But the headache was 2014.
14.
Then I get on medicine because just a young man wanting to be a young man, not wanting to accept and just want to provide for my daughter and my wife. Yes. Yes. Try to make it seem like there's nothing wrong with me. So yes, I did take a burden on those 2 years, and then I finally got on medication.
All right. So along with that, you also have burning pain left side. That you said that's arm and leg?
Yes.
Just the whole arm?
Pretty much, yeah. Like the 2 fingers here,
Okay.
and then it's pretty much all of this here, and then underneath, and then really bad on the shoulder.
Okay. The MRI that you have, I'll go over that in a second. That's going to explain, you have a neck MRI. We'll go over in a second why that's happening. But tell me about the leg. The leg also you're having?
Yes, it starts from the hip, and then I just get a real bad burning sensation, almost like if I'm just constantly like this. And then you let go and you get that, ooh, that burns. It just feels like that.
Okay. So both of those are going to be from your spinal column. What I was mentioning earlier is that when you have a trauma, like you're saying, get a car accident of that severeness, the brain actually is made of mostly fat, and it actually moves with different viscosities. The inside is what we call white matter, the outside is gray matter. And the outside is actually a little bit, what do we say, it's a little thicker, and so it actually will move differently than the inside moves. And so the connections between the gray and white matter is actually what tears, and that's what we call concussion. So you had a concussion, and then even the football where you passed out, you had multiple concussions here. And our understanding completely of the brain is very juvenile right now, but we do know that the brain can reroute and reconnect, and it's through, sometimes it would be mental games, exercises.
Correct.
Through stimulation. We want to try to reroute and reconnect your brain. And then we also have circulatory. So one of the definitions of a migraine, a true migraine, is what we call ischemia of the brain. So part of your brain was actually not getting enough oxygen. And so your body was telling you, lay down, take a break, and then you have work and stuff to do, and you can't necessarily do that. And so your body forced you to pass out. It's like, stop. So the circulation to your skull comes from 4 major blood vessels, your carotids, which branch into internal and external, and then you have these vertebral arteries that go up the side. Something like 30% of the blood roughly comes from the vertebral arteries. So the vertebral arteries are influenced, if you can see on my model here, they go up the actual side of the cervical vertebrae. It's this red part here. And so when there's movement of the neck or tension in the neck or inflammation in here, you can have constriction of that one of the 4, well, 2 of the 4 arteries that supply blood to your brain.
Right.
So there can be also spasms in the front part of your neck that affect the carotid. So all the circulation essentially can be affected by the health of your neck. And when you have whiplashes and concussions of that severity, to be able to answer specifically what's going on, but in a very generalized answer, I want to just go through and just clean your neck up a little bit and to see if we can just release some of the tension that could be putting pressure on those nerves, freeing up your brain to try to rehook up as best as it can. Do you have any idea about the kidneys? Why are you having so much kidney issues? Do you drink a lot of water?
Yes, I'm not gonna lie. I used to work out too, proteins and stuff like that.
Okay.
They were just basically explaining to me, as in the trauma, my body released proteins.
Okay.
And as me being a protein drinker and going to the gym, I already had a lot of proteins in my body and my muscle and whatnot.
Okay.
So my kidneys, I guess they say it wasn't just, I don't know, fast enough or whatnot. It was just too much protein for the kidneys. And so that's why they just kept telling me to get on dialysis.
Another thing to think about is that the kidneys are under the control of your spine. So I'm a little curious to check out the nerves that leave your back that go to your kidneys. Ultimately, all of our organs don't have any intelligence. The brain communicates intelligence to your body. So the function of your kidney is dependent on the nerves that leave your back. Could be the protein. I'm not saying I know, but I've seen a lot of people with organ dysfunction coming from the your spinal column not being healthy. So I'm very curious to see the nerves that go to your kidney. I bet this area here is pretty inflamed, and that could at the very least cause dysfunction of your kidneys, and then when a stressful thing happens, your body can't keep up.
Correct.
Because the nerve flow from your brain to your body is impaired. So as we clean your spine, I'm going to be checking that out. Has anybody gone over this MRI with you? Did they show you this MRI of your neck? Did they go over this at all? Not really.
My chiropractor did. He said I had a bulging or
herniated disc.
There you go.
Yep. Yeah, the disc is. So what we have here is this is the back part. So you're looking to our left. We're looking at a side shot of you.
Okay.
Okay. So it's your jaw would be right here. So you're looking to our left. These little bumps here. It's hard to see these little gray things. Those are the spinuses that you feel in the back of your spine. Those are the bumps back here.
Okay.
So you're looking to our left. The white there is cerebral spinal fluid. The gray cord, that's your spinal cord, going down the spinal canal. So you see that? That's your spinal cord there. That's your nervous system. Basically an extension of your brain. So what we're going to focus on is this disc right there.
That's okay.
That's the part of the disc that's actually starting to come out. There shouldn't be any disc on the back, so posterior or backwards of the, so this is more normal, I'll show you. See, the disc doesn't go more to the right of the back side of that vertebrae versus this guy. Now this is the whiplash also, either football or car accident. The back of the vertebrae should line up. So if you draw a line up the back of that vertebrae, see how that perfectly lines up there? That guy perfectly lines up, and this guy's a little bit forward. This guy lines up with that guy, and these guys line up. But so we call this a anterolisthesis of 6 on 5. So the C6 vertebrae is forward, and that's what's actually causing a shearing force that's grinding that disc. Do you understand? If the discs can handle compressive forces very well, but they can't handle shearing forces. So whiplash, now this is the best picture we have. MRIs is the best technology, but even with that, we can't really, like Star Trek, see the microscopic little, but there are tears in these, there's a ligament that runs, and this is the best technology we have, but it's blurry. We have blurry images of the ligament that runs on the front side and back side. So basically a piece of fabric is supposed to prevent that from sliding, and that's been torn through whiplash motion. You've ripped the fabric or cables that are supposed to prevent that shearing force. We know through chiropractic research and through just stretching that the more curve that's in your neck, that misalignment will go away. So they've done pictures like this, and if you actually tuck your chin down, it gets worse.
Oh, wow.
So this picture is taken in neutral. You're just looking straight forward.
Correct.
But if we actually took another picture of you with your chin down to your chest, you would actually see that drop off more. And then we also see that if you actually bring your head back into a curved position, that misalignment goes almost away completely. So the fix for this involves restoring your cervical curve.
Okay.
And understanding how to maintain that curve. But this puts a lot of pressure not only on your spinal cord, but the nerves leaving there start to get inflamed. The nerve that leaves here goes to, we call it the C6, it goes to your thumb and index finger.
Okay.
That disc is, when you were pointing earlier, right here, Ed, each part of your body, each one of these nerve levels has a certain section, we call it a dermatome. Certain part of your body is controlled by one nerve, and that specifically is coming from that disc. You have involvement at that area. So that nerve pressure there is giving you this. It's going to be burning. It could become numbness, but it's essentially not only does it go to the arm, but it also goes to the shoulder blade. So you're going to have pain in the shoulder blade. That's called the joint pain. So you have two injuries. You have the knuckle, the whiplash caused damage to the joint, and you have nerve pressure down the arm, radiculitis we call it. The same thing's most likely going on in your lower back. We don't have an MRI of your lower back. They took an x-ray, unfortunately, so we can't see. You're too young to be able to see bone spurring, a lot of bone spurring at your age. And so to see the injury that's causing your leg would require another MRI. Okay. It doesn't necessarily change my treatment, and your symptoms are enough to pretty much 99.9% explain that, but it's another disc injury. That's another disc injury, most likely at L5, L4 in your lower back, that's putting pressure on the nerves that leave your lower back. So this model has a herniation at L3, and that disc starts to put pressure on that nerve, and that nerve goes down your leg.
And that's what's all that.
That's what's causing that. So the treatment is we're going to try to avoid heat on that. You're young enough that these discs are made about 70-80% water, so we want to not put heat. I know, especially when it's hurting, be very careful with hot showers.
Oh yeah, no, I just slowly started adjusting to try to take a cold shower.
Take a hot shower, but just don't be sitting there with your back.
Oh, just lean on it, yeah.
Round and forward with heat hitting that, because the heat will swell that disc up. So be careful take a hot shower, but just let the bottom at the front of you, the side of you. Briefly is fine, but just not for 10-20 minutes. Just
constant,
sitting there around it, heating up that disc, especially when it's mad, if it comes in different waves. But we're going to do a couple things. We're going to try to also restore the curve to your back. Same thing, we'll start teaching you about what we call the lumbar lordosis. So this arch in here must be going straight to allow all the stress to go down here. And then also we're going to be mechanically loosening your middle back to take stress off this. So if you hit this nerve, this would create a different pain. Do you understand? And you're not saying those. So I know with pretty good clarity that these aren't injured. Do you understand?
Yes, sir.
Because there'd be certain symptoms you'd be telling me about that you're not telling me about. Yeah. You're telling me about pressure on these nerves. So in order for this area to be mad or overworked, there must be another area that's underworked. And that's what I hope to go through with your back and unlock. And that area up here that's also frozen and congested is also the nerves that go to your kidneys. So it's they're all tied together. The first phase of care is what I call the demolition phase. We're just going to go through and clean and adjust, try to get all the parts moving, and at the end of the visit, we'll try to show you some things that you can do at home to try to work on these curves.
Yes, sir.
Okay, bud. So you've lost almost all your curve in your neck. There's maybe a very small amount below where the injury is, but MRI really shouldn't be used as a way to determine how much curve's in a neck to begin with, based on this was probably taken laying down.
Yeah.
So it's not a mechanical position. Your neck will be it's not meant for analyzing posture. So this is with you laying down, meaning there's no gravity on the tire. If you have a car with a flat tire and you lift the car in the air, so this is as best as it looks. Does that make sense? They take another picture of you seated, it would go out another couple millimeters. Does that make sense? Like a tire that's flat.
Yes.
You put it on the ground and you start to see it bulge out more. So they kind of do you a little bit of mechanical disservice by taking a picture laying down, because it's just a little guy. it's actually worse
not,
than this
yeah.
because this was taking what we call non-stress view. It's a non-weight bearing picture. So I'm a mechanical guy. You understand? This is a mechanical structure, and there's no gravity on this picture. This was, even though I'm showing it to you upright, this was taking laying down.
Yes.
So you're missing a few elements of what's going on here. These are tough injuries. These are tough injuries, especially the spinal stuff. I'm extremely confident I can. This is easy. The arm and leg relatively are easy fixes. The seizures we're dealing. That's another injury. You understand? That's a brain inflammation, circulation.
Yes.
You know, that's a multifaceted, multivariable equation that's creating that. And so, you know, the treatment really is, let's just see what happens when we take pressure off these other circuits. All right, I want you to take one deep breath in and sit up for me. I want you to go head back, try to relax your back as best you can. Here we go. Deep breath in for me. Head back. Let it go. Deep breath in. Head back. Chin down. Nothing, okay. So a couple levels of restricted motion and almost nothing there at the top.
Okay.
We're going to unlock you. If your back moved beautifully, I'd be confused. Do that make sense?
Yes, sir.
I expect to find some dents and dings here. Deep breath in. Exhale. Really easy. Good, okay. You all right? You okay?
Yes, sir.
Other side for me, very good. The goal of this adjustment is to loosen above and below the injured area. So 99% chance disc injury in your lower back. It would be unfortunate if a chiropractor put his hand in that area and tried to move that bone. Does that make sense?
Yes.
Because that's where the injury is. It's like having a cut on your skin. You want to leave that cut alone. So what are you doing to me, Ed? Why are you doing this twisting thing? We're trying to loosen up the joints above and below. One, the SI joint below, the middle back above, to divert stress away from the injured area. Okay, bottom leg straight. I got you, bud. I'm not doing a huge body slam because I'm not trying to put any stress here. Do you understand?
Yes, sir.
I want to make sure that I just move this enough without putting any force here. So sometimes people might look at it and go, I think if you did a huge wham on him, it would be a really cooler video. I'm not trying to because I want to be careful to not. You basically told me symptoms of a disc injury,
correct,
right? We want to be careful to not move that disc injury. Deep breath in, I got you. Exhale. Good. Good. All right, good. Face that for me. Good. So the idea is just enough motion to move the area that we want to move. That's why we call it an adjustment, not a manipulation. We're trying to adjust certain areas without moving other areas. All right. Yeah, gee whiz. All right, so you're pinching the left because there's a huge knot here on the right side of your neck. Wow. You have an injury either from the 16 or 18 that injured the right part of your neck. And in response to the right side of your neck being injured, do you understand? Your head tilted left to get away from it. It's like if you bust your right ankle, you
want to get off of it.
You'll lean the other way. So I got a large injury on the right side of your neck, and now because of it, your head's tilted left to get away from it, which is making the bones slide to the right. So I'm feeling the bones sticking out on the right side of your neck. Because your head's tilted left, you're going to pinch the left lower. Do you get that? See, because if your head goes this way, now you're going to squeeze this. Does that make sense?
Mm-hmm.
So that's what's causing the left side or the left arm to be more aggravated.
Okay.
Because the disc has the potential to hit both sides, the left and right. Why is it hitting the left side? Because the left side of the disc is actually being ground or compressed more, and that's making the disc and inflammation build up on the left side. It's also giving the joint pain on the left. So part of your treatment is going to be to get off the left. And we have to process and clean the right side of your neck so that he can get away from it. The main problem is the right side of your neck. On this right upper, we're going to try to compress it. Real gentle. I got you, bud. Here we go. Okay. That's about 90% of what we need to do is get that bone leveled out. I got you. Let it go. Okay. How'd that feel? You okay?
Great.
Okay, good, bud. You'll notice you probably like to sleep on your left side. You got to get off
Always,
your. I know. Yeah, I can tell. Your head. does not like tilting to the right. I wake up in the morning, I examine posture, and I go to bed. That's what I've done for the last 15 and a half years. And so it's like reading a book. You start understanding stories that happen repetitively, like the movie Groundhog Day. It starts
the same way.
It's the same story, yeah. And so I've treated this in many other people, and it begins with cleaning the spine. Having this much misalignment in your neck is going to influence the circulation to your brain. Not saying that's the only aspect. It's absolutely, like I said, a multivariable, multifaceted equation that in conjunction with everything else, that's why it didn't happen immediately. You understand?
Yes.
You know, you had these injuries and you didn't immediately start having seizures.
Correct.
Do you understand? Because it was a piece of the puzzle, and then additively, all the other things started, mounting up on top of it. Life, stress, worry, work, and then now you're symptomatic. And so the good news is all we have to do is clear up some pressure on a few things, and you should see some pretty dramatic differences. Just taking some stresses off a few things should give us some pretty good relief. Okay. But yeah, right there. Wow. Has anybody shown you this knot?
No.
No, yeah. Yeah,
I would have never known it was there until right now when you first started.
Gotcha. All right. They just putting lasers on your back and electrical pads and zapping you. There you go.
Yes, sir.
Get out of here.
Yep. I don't want to see you.
I'm so sorry. What's difficult is that every doctor knows that half the spine has feeling. So what happens if my care focuses on just moving all the stress to the non-sensitive parts of your spine? You'll be feeling better, yet I'm not increasing the health of your spine. I'm further actually putting you down a road that's going to lead to surgery. But temporarily, you'll actually feel better because I can help you avoid your problems. So if I help you, if the IRS is calling and I just teach you how to avoid the IRS, does that make sense? The problem's not going away.
No.
But I'm just temporarily teaching people to avoid their problems. Instead, what I teach in here is confrontation. We're going to confront the problem, deal with it, and then there's not going to be a problem that needs to be avoided. We got to get this arch back in your neck. It's paramount. This is the whole... I could put out my sign out in front, McLaughlin Chiropractic, disc rehabilitation, posture rehabilitation. We have to get your alignment fixed. If your tires are not on straight, your tires wear out unevenly. If you keep replacing tires but don't fix the alignment, this is just silly. Mm-hmm. That's silly. You're never going to get a tire to last very long if you don't fix the alignment. Your alignment is not on straight, and it can't be fixed by just adjusting you. It can't be fixed with electrical pads. It has to be fixed the same way it was created, which is stretching. Time in the wrong position. We have to put you time in the right position. You start to see it, Carlin. There's the injury. So either the football or the car accident, this joint got jammed and, it slammed together, like something hit you from let's see, if you got hit from probably either the left side, you got hit and then it whipped or something happened that jammed this.
Yeah, and I'm pretty sure that had to do when, like I said, in 2021, I was assaulted. It was all the right side.
Bam, just got jammed in
here. Hitting.
That's
Sorry,
horrible. Like what?
Yeah, like I said, it was two fracture over the bone, but I got one plate here and just went healed on its own.
Gotcha. I'm sorry, bud. Let's see if I can get a little bit more. There we go, a little bit more. Yeah, it moved. You did good. It was real quiet, but it moved. Okay. Now we got both sides are misaligned here. I got a left lower, a right upper, but both middle part is not only rounded, slouched forward, so all these bones are sticking out up here. They're also stiff, tight up here. And so because this is tight, your lower back is compensated. You need to loosen up this area. And then I'll show you at the end of the visit how we're going to stretch. But this is all popped up right here. If I'm going too hard, please let me know, okay? I'm going to keep going deeper. Let me know if I'm overwhelming you. Wow. I take it no deep tissue work's been done on your back?
No, sir.
You know it. Just, does anybody run a vacuum cleaner in here? No, nobody's. I think I did a broom once. Okay, I can just tell that this has been sitting in here a while. That's been enveloped and gotten tighter and tighter, and it's kind of like like a plant that keeps growing or a weed that keeps growing, and now you're trying to pull it, and it's like, geez, it's got roots that are
way down there.
Way down there. Yep, you got it. All right. Yeah, it's right where your kidneys. Right here's the kidney. Like I said, I don't find it coincidental that we've had multiple occasions of kidney issues. In this area where the nerve flow from the spine goes to your kidney isn't really happy, and so it's at the very least, a piece of the puzzle, of what's going on. So, cleaning this up. Right there.
Ooh.
All right.
Yeah, one doctor was literally trying to ask me a question when my jaw was just hanging there in two places. So I was like looking at her like, are you wanting me to talk back to you? Or so I did, asking me where my pain level was at.
Mm-hmm.
Kept putting up a 10, and she asked me where I think my nauseous level, I guess, from the pain. I just kept going 10, 10, 10, 10.
Yeah.
Like, I didn't open my mouth. Like, can you tell? Like, my mouth, and I'm talking to her. And my bones, my jaw bones kept hitting each other when I was talking to her.
Oh, sorry.
Wow.
I know. You never felt anything in here before. I know.
It goes all the way down to my toes.
Yeah, this is the nerve has to travel through this area, so tension in here sensitizes the sciatic nerve. It's at very least, again, it's a piece of the equation of all the things that add up to irritate the nerve to then give you that symptom.
Woo.
Okay.
God damn.
I know.
Sorry.
You're fine. It's tough. I know the first time nobody's stuck their elbow in my butt before. Nobody's dug on that joint before. Right there. That's gotta be pain-free. All right. Wow, that is a knot. Jeez.
Oh. 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 Oh.
You're fine. Okay, all right.
Woo.
Gotta clear that. Yeah, now that I've actually felt it, the left actually is softer. I thought the left was pretty stiff, and then gee whiz, this is the right, same thing as that right side of your neck. The right side of your middle back is real tight, and that's again making you tilt left, and you're pinching the left on the lower back also. This is way stiffer right here. Just no movement. That's just totally locked. Blockade. Jeez, I'm trying to stay on the thing. Yep.
Wow. It just got me realizing why I always slide my feet on my left side and just drag on my left side so much.
Yeah, there's not, like I said, you'll start getting a paresis. Like I said, your foot can't control it properly. You know, the nerve supplies the function, so you know your left foot's not going to work. Left leg's not going to work. So you got to get the pressure off the left. But you're avoiding this. This right side's being sitting on the sidelines, just watching the game, and got to get this back in the game. All right, take a break.
Whew.
I know, you didn't know any of this existed.
No.
Nobody's going in here, and an electrical pad is not going to fix this. You got to dig all this out of here.
Okay.
Okay, all right, all right, all right.
Okay.
Woo-wee.
It's amazing when you don't know what's really wrong with your body. Oh.
All right, go easy. I'll go easier. Come on. Come on. Breathe. There you go. Come on. It's tough. It's tough. We gotta start somewhere. Gotta start getting some blood flow in here. Come on. There you go. There you go. A huge knot right there. Gee whiz. The tightness in your upper back is contributing to your lower neck overstressing also. So this area that we first checked when I did that hug adjustment, and this area didn't move, it's, you know, there's some responsibility in here for why even the lower neck is injured. This area's quit. So the more movement I can get here, the more we take off. Right there. Yeah. Right on that. Gee whiz. It's worse on the right here. Okay, all right. It's a good thing your buddy's not like in the hallway. He's like, there's an exorcism going on in there. What the hell did he do to you? He's like waiting in the car. That's good. I thought I was going to come in here and save you, man. Let's get out of here. Oh, man. Yeah, yeah. Right there. got you right there. This is the combing, just a way to increase circulation. There's little marks coming out on your back. The marks are the evidence of what is causing pain, inflammation, acidity. So we're just trying to clean up your back here. Is what I mean by clean is getting ultimately this stirred up and out of here, and then to a place where I could do this and nothing happens. Your skin just becomes pink. It doesn't get this dark reddening, which is what essentially is a nerve irritant. This is the area that goes right to your kidney. The nerves are traveling through here.
Wow, it just feels like I can't relax now.
You're fine. Okay. All right. Great. You okay?
Yeah.
All right.
I'm just saying, it just feels like I can't
Sure.
breathe out.
Sure. This is the nerves that go down your arm, go right through this channel here. So we're trying to clean up that channel, but we have to stir it up a little bit to get it clean. Wow, that's just a lot of tension there. Right on that. There it is. Good. Nice. Good. There we go. Gotcha, bud. I know. Epsom salt bath would be, do you have any ability, no tub?
Unfortunately, no.
You could do like a salt compress, get some Epsom salt with some water, get a cup, and just let the salt dissolve a little bit in the cup, and then just take it and take some salt out of your hand, out of the cup, and then just kind of put it on your glute. If you get it, reach behind you and get it on your back here. Try to lay get like a damp cloth or something like that and lay it over for 5-10 minutes, just
Oh, cool.
like a salt compress. And it's not, just another way to help get the soreness out of your back.
Yeah.
There's so much tenderness in here that the nerve is actually sitting in that tenderness, and that's part of what's making the leg hurt, is the agitation that the tissue that's surrounding the nerve is irritating the nerve with. And so there's a component of cleaning the tissue that the nerve is sitting in, relieving the pressure off the nerve in the lower back, moving the stress to the middle back and hips. And so all these pieces will alleviate that pain. All right. All right, just slowly come up for me when you're ready. That's that same area that your kidney goes to. All that inflammation in there, it goes right to your organs. That's the blockage and restriction that's making your lower back overstress.
Yeah.
And the same kind of thing in your upper back here. This is all jammed, making your lower neck overstress. All your toes are jammed up, Wow. Okay. Ooh. Almost 5 for 5. Okay, gotcha. Okay, good. Okay. Ooh, that felt good on my end. Ooh, nice.
Another one.
I got the pinky on that one. Can't get. I'll take your toe off. No, that's it. I'm going in there. All right, fair enough. Oh, yeah. Have you put your hand around your hip for me. Kind of look up for me a little bit. And then press back into my elbow. Press back. There you go. Good. Good. Okay.
Wow.
Just try to stretch your shoulders back a little bit. Check your ear. I got you, bud. Go ahead and tilt your head left. Go ahead and tilt left. Go ahead and tilt your head left or right. Okay. All right. Tilt. Good. Okay. I know we beat you up pretty good there, but how does it just? Well, I know you were shaking there for a second. I know it was a lot of blood flow stimulating. Tell me how you.
Oh, I'm feeling really, really calm.
All right. Good.
Really, really relaxed.
All right. Excellent. Maybe right over here. This is about good size for you. About middle neck, middle upper neck is where we're going to be targeting this. The idea is you put it in your middle upper neck. Sometimes you'll take your hand, you'll place it on your forehead, and you press. Try to get your head to sink into it. Does that make sense? And then you put your hand back down and relax. So that, remember how I mentioned earlier, the more curve that we bring back to your neck, that disc injury, tear that's causing that sliding force is going to be minimized by the restoration of your curve. So we need to, to some degree, to slow the aging of that disc. We want to be aware that every time you tuck your chin down, there's a little bit of sliding being put on that disc. And so work and life and kids, I get it, and so it's hard to avoid it, but you're trying to use your peripheral vision, not always.
Yeah.
Being aware of, it's really about the chin tucking. Every time the chin comes down, so as best you can, understanding that and laying on your belly, arching up when you're playing with your kids, or when you're watching TV, keep your computer, the monitor's eye level, when you're on your phone. All these things need to be understood now for the care of your neck. You need to start, you're allotted so many chin tucks every day kind of idea. Because every time you tuck your chin, you're 33 and your lower neck is 55. You understand? So by the time you're 50, I want it to remain 55. I don't want to see it being 80, right? So we want to slow the aging of the part of your spine that's older than you are. And to do that, we need to keep the upper neck loose, get the curve back to your spine, and that's going to slow the stress that one area is under, and that's also going to help the arm feel better, because the arm, the shoulder blade, the neck are all the same thing. They're all in the same circuit. It's like your kitchen and your microwave and your stove and your fridge. It's all in the same circuit. If your neck starts to hurt, we got to put more behind your head. I'm not trying to bend too much in your neck. Does that make sense?
Yes.
So if the neck is bothering you, you're going to need to put some more blocks or books behind your head.
To basically bring it up more.
Right, to elevate you more, because I'm intending to make this area hurt. I'm intending for this area to bend here, and so go ahead and with your feet push and roll upwards. Try to roll upwards towards me. There you go. Get the idea?
Yes, sir.
And then breathe, relax your chest. Now relax. Just about every minute you move 1 inch. So go ahead and stay here for a second. Go ahead and put the feet together, knees together. Very gently, slowly rotate your knees left. Breathe, stretch. Good. Put your roller from the upper back all the way down to your middle back. So you can keep going until this thing. So we leave the lower back alone, and you're going to stop. Remember where my elbow was digging in the middle back? And now if it starts to hurt, if you press here and it starts hurting down here, you got to stay high. Okay? So you're not allowed to go down sometimes. Go ahead and roll down another inch. Yep. Push. There you go. Go down another inch. Good. Get the idea?
Yes, sir.
Right, and so you're going to now do the same thing. Knees left. You need to unlock all of this. All this has to be woken up, loosened up. It's like your middle back has been forgotten. And we have to get them back on the field. There's also going to be a little bit of a sympathetic, parasympathetic also, because your body is used to going forward, and this is where home is. And as you stretch back here, You're going to run into things in your spinal column. It's going to make you feel a little odd. So if that means you have to stop at 5 minutes, so be it. You understand? That's okay.
Yes,
Don't kill yourself and try to go for 20 minutes and make yourself sick. You know, if you start feeling something, get off.
Yeah, get off of it.
But, you know, you're not, the only contraindication would be, Ed, my lower neck's killing me, or my arm's killing me, or your leg's killing you. You understand? The things that brought you in today, if those start
Yes.
getting worse, you got to call me and talk to me.
Okay.
You know, but if it's hurting, Ed, it was killing my middle back, or my upper neck was sore, keep working on it. You understand? You're not, those areas need to be
Constantly
beat up a little bit to wake them up, and so they're going to complain. And so that's a good pain in that sense, that we need to reestablish a mechanical
Get them
movement.
working together.
That's right.
You
And your
did,
mask, sorry, your mask.
you did really well.
Very good.
So, how are you feeling right now? Shaky still?
Oh no, ma'am, not at all. Just very calm, just very good. Yeah, it's just great. I'm
Good.
so glad I just made this drive.
Aw, thanks for coming.
Thanks for
All right.
coming.